During Breast Cancer Awareness Month, we've been highlighting the stories of women who survived the deadly disease and the doctors who helped them. But breast cancer isn't just a woman's disease. This morning, we're going to focus on breast cancer, specifically in men. The American Cancer Society say nearly 3,000 men will be diagnosed with invasive breast cancer just this year. 1 in 833 men will develop breast cancer in their lifetime, and about 530 men die each year from breast cancer. Of course, we're paying attention to this during Breast Cancer Awareness Month. And while those numbers pale in comparison to breast cancer rates in women, the fact that male breast cancer is so rare is what makes it so dangerous. So joining us this morning, Dr. Paul Barron. He's the director of the breast cancer program at Lenox Hill Hospital, and breast cancer survivor Anthony Ferreri, who's also a doctor and the regional director for Northwell Health. So good morning to both of you. Good to have you here.
Good morning.
So I want to begin with Dr. Barron because the question is, are breast cancer rates among men increasing, right? It seems like the numbers are going up. What are the survival rates?
Well, they're slightly increasing, but the survival rates are actually fairly comparable to that for women. The problem with male breast cancer is it's so rare. It's about 1% of breast cancers compared to only about 208,000 for women each year. That we don't have any real effective screening tool. There's no effective way of screening for it. So it usually presents with a palpable mass, and so by definition, it tends to be a little more advanced when found. But certainly stage for stage, the patients do the same as women with breast cancer. The treatment is the same. It's a combination of surgery and systemic therapy.
Right, but sometimes it's getting a man to want to even go to the doctor in the first place, right? That's a struggle for some men. So Anthony, you had what was a cyst in your armpit at first, which you thought was benign. It obviously turned out to be cancerous here. So talk to us a little bit more about what exactly happened and how it developed.
Well, it goes back a number of years and maybe a different path than most people. The cyst was discovered 30 years earlier during a pre-employment physical and an application to a hospital, pre-employment physical at a hospital. At the time that the cancer was discovered, I had noticed that the cyst had grown over the years, over the 30 years, to the point that it became quite large, the size of a golf ball.
Wow. And
again, avoiding to do anything about it at that point, not thinking much about it, annual physicals with primary care physicians who indicated that if it's there 30 years, it's probably nothing, don't worry about it.
Yeah.
Until eventually I had seen a surgeon, because doctors don't typically look at the same symptoms that men have when compared to women and think breast cancer.
Right.
So eventually I went to a surgeon who said, it really doesn't belong there. Let's take it out. I'm sure it's benign. And it turned out to be cancer.
So did you have to have treatment after that?
Started with first the surgery to remove the tumor. When the biopsy came back positive, they cleaned around the margins. In the second surgery, I was at 2A, breast cancer, so I needed to go through chemotherapy and radiation therapy as well.
Well, I'm glad you're cancer-free now.
10 years later, ironically, if I may, I was the president and CEO of Staten Island University Hospital at the time, and the chairman of the board of Staten Island University Hospital at the very same time also developed breast cancer. Unfortunately, he passed. So it's important to get awareness out to all, regardless of whether men, women, even physicians, to look for these types of symptoms in men.
So Dr. Barron, just as in women, early detection is key for men. So when do men need to come in and get screened, if they're particularly listening right now, and what exactly are they looking for?
Well, the truth is with men, a common presentation that I see is what's called gynecomastia, which is kind of a benign swelling of the breast, and they're always concerned that, do I have cancer? And that's much when you see that, it's more common in both breasts, not as often one side. But certainly, if there's a new mass that shows up that they can feel, I just actually recently saw a breast cancer patient just 2 weeks ago, a male breast cancer patient, and that's what happened. He felt like a new nodule behind his nipple, and a very fit guy, and he noticed that his nipple and areola had changed. And it turned out it was cancer. And interestingly, too, historically, most men require mastectomy for breast cancer, but you can also do a lumpectomy in them if there's like enough breast tissue to take it out and have clear margins. So the treatment's again the same. One other important point to point out is that there's also a slight increase in breast cancer in people who have a BRCA2 mutation, which are BRCA2 mutations. So when men show up with breast cancer, the next step is to get genetic testing in them, also to make sure they don't carry it for other members of their family.
You know, we particularly paid attention to African American women and how there were some higher rates there. Are you seeing Black and Latino men at higher risk of developing breast cancer?
Not that I know of. Part of the problem with African American patients is that they're more frequently showing up with an aggressive form of cancer called triple negative breast cancer,
Okay.
and that's a much more
Okay.
dangerous.
And Anthony, you know, you're 10 years cancer-free, which is great news. But do you still have to go get screening every single year, or how does that work?
Initially, the screening took place every 3 months. Then after the first year, every 6 months. And now I go once a year for my screenings. And fortunately, all is good.
Good. I'm glad to hear that. Dr. Paul Barron and Anthony Ferreri, thank you both for being here and shedding some light on this side of the breast cancer talk during Breast Cancer Awareness Month. Appreciate you both.
Thank you.
Okay.